Welcome back to two more of our guests, and welcome for the first time to another. We'll start with Yvonne Bullinger from Grace Hill. Thank you for coming back. Rob Friend, Regional Health Commission. Thank you for coming back, and thank you for being here for the first time. Ms. Erica Neal, let's just jump right in where we just left off in that story, the coverage gap. What is the coverage gap?
Under the Affordable Care Act, people over 100% of poverty are able to go to the marketplace and get subsidies to help them purchase their insurance. Unfortunately, if you're between 0 and 100% of poverty, so if you live in poverty, you're not eligible for any subsidy on the marketplace. You are supposed to be covered by Medicaid. And that program was supposed to take care of your health care needs.
You say supposed to because?
Well, because along the way to the implementation, the Supreme Court got involved and said that the Medicaid expansion part of the Affordable Care Act was optional for states. And so states could take the federal government up on their offer or not, and it's up to the states. And in about half the states, they have expanded Medicaid up to 138% of poverty. There is no coverage gap in those states, and in some states they haven't. Missouri is one of those that has not yet expanded Medicaid. So everyone that lives in poverty in Missouri is still uninsured unless you are pregnant, disabled, a child, have kids that make less than $10 a day, or happen to have a job that pays you wages that put you into poverty, and your employer gives you coverage, and that's rare.
Erica, you know a little something about this gap we're talking about here.
Just a little bit. I, in 2011, experienced what I describe as a perfect storm. I had a cancer diagnosis which led to surgery. At that time, I was fortunate and blessed enough to have a Cadillac health insurance plan. After surgery, I found out that I was going to lose my health insurance in December of that year and also take a pay cut in that year. And so for 2012, that left me without any health insurance, which meant the subsequent tests that I needed to have to monitor if there's any recurrence of the cancer, I was not able to have. I was fortunate enough to have met Rob in 2013 this year and was able to get into Gateway to Better Health, the bridge program between the implementation of ACA.
And we want to talk more about that, but if not for that, let's just play this scenario out a little bit here. When everyone starts signing up for the new health care coverage, the ACA, and then there's Medicaid on the other end, you would have found yourself, and you are right in between those two.
I would not be able to get into the exchange, and I would be without health care. And I wouldn't be able to have the diagnostic test that I'm able to have now.
Is this a familiar story with you at Grace Hill?
Yes, absolutely. Just today we had a patient that was in a similar situation that came to Grace Hill, and he came and we discovered some skin cancer, and that was discovered, and then now he's receiving treatment, and if it wasn't because of the Gateway to Better Health, he wouldn't have access to that. He's currently unemployed, so he has no income. So we see many, many patients. We have about 9,700 patients at Grace Hill currently who participate in the Gateway to Better Health program. So we're very grateful for our patients that we have.
And what is Gateway to Better Health? What is it? And thank goodness we have it. Sounds like all of our problems are fixed.
Well, Gateway to Better Health is a coverage program only available for people who reside in St. Louis City and County, and it's only available for adults 19 to 64 years of age and who are under 100% of poverty. So it's not available to everyone.
And I was being facetious, I shouldn't be. How long do we have Gateway to help?
And right now it's only approved until the end of next year, December 2014.
And then what? When it comes to that gap between Medicaid and the exchanges?
One of two things. One, a lot of people will go without health care at their community health centers, which they have now. They'll go without prevention. They'll go without getting the tests, as we said. They will present very sick. The irony is when you get very, very sick, you become disabled, and then we'll pay for your care. But we won't pay for the care and the coverage needed to keep you healthy in the first place at our community health centers. We're fortunate we did get this waiver for outpatient care. It doesn't cover the inpatient side. Gateway to Better Health only covers outpatient at our community health centers. It keeps our community health centers in our urban core open because we have so many uninsured here in St. Louis. But if we lose that program and Medicaid's not expanded, you will see 25% of all community health centers in St. Louis, like the one Yvonne works for, will shut down. You'll see 50,000, 70,000 probably additional emergency visits flood our urban core, and you'll see St. Louis on the front page of every national publication in the country is how the whole system kind of collapsed out.
Are we starting to see that already? There was an urgent care in the news this week that closed.
One of our we've already had 1,000 layoffs in the healthcare sector already this year, and that's even before the major cuts begin. The thing about the Affordable Care Act is it was graded out as budget neutral by the nonpartisan Congressional Budget Office, which means you got to pay for it some way. Well, the federal government is taking $4 billion out of Missouri over the next 6 years to help pay for coverage. The replacement funds were supposed to come with Medicaid expansion. And if we don't take Medicaid expansion, we don't get the funds that Grace Hill needs, that BJC needs, that SSM needs to continue health care in our urban core and in our rural areas. And you'll see hospital close, you'll see health centers close, no kidding, and people will have nowhere to go.
Of course, if Speaker Tim Jones were here from the Missouri legislature, he would say that was the system, Medicaid, that wasn't working very well in the first place, so why do you want to pump more money into it and make a bigger ill-functioning system?
And the answer would be the choice isn't between current state and pumping more money into the system. The choice is between losing $4 billion to help pay for coverage in other states over the next 6 years, or expanding Medicaid. And it's the negative consequences that we need to avoid. We'd like the doctors at Grace Hill and Family Care and Myrtle Davis and BJC and SSM to be able to do their jobs and take care of our population in our urban core. And without the funds available, they just won't be able to. Again, you mentioned we already saw Connect Care close over the last 30 days, just announced it. We'll continue to see closures of major medical institutions across the state because we just don't have the money to operate them because it's being pulled out for coverage in other states.